population. So the first thing we do is we act as educators. As you all know, when a patient's diagnosed, the need for information is enormous. When patients and families are called to learn about the disease and the treatments. And basically, these patients and their families have landed in a place that they didn't ask to be. And to get along, they have to learn a whole new subject area. And if you think about that subject area, it's not an easy one. They have to learn neuroanatomy, neurophysiology, and pharmacology, all in the same time, sort of managing many, many appointments with healthcare providers. The other tricky part is that often the patient is still recovering from surgery, and so this burden often falls on the caregiver. And so it's up to the caregiver to learn this new vocabulary and how to navigate and sometimes wrestle with the healthcare system to get what it is that they need for their loved one. In addition, they're having to continue working, run the house, manage the finances. So as you can imagine, this is really a busy and stressful time. So as nurses, I feel like it's an honor to be able to be there to help patients and their caregivers navigate through the healthcare system, sort of reinforce what they've learned from the doctors, be available to answer any questions, and sort of assist as they go along. One of the other things that nurses do in conjunction with the healthcare team is manage symptoms. And if we can manage some of the patient's symptoms, that can have a definite positive impact on quality of life. So at the same time that the patient and the family is trying to learn all this new information, they're sort of grappling with the ramifications of the side effects or the symptoms of the disease and the side effects of the treatment. So a lot of patients have changes in their physical capabilities. They might not move as well, they might not see as well, so their safety is impaired, their mobility is impaired, and a lot of them have real diminished energy as well. They may suffer from changes in their cognitive capacities, meaning their memory might not be as good and their processing is not as good. And we also see changes sometimes in personality and mood, which is not always due to the tumor itself, but sometimes the medications. And so what we try to do with the doctors is think about how we can make these things better. So we might suggest changes in medications if that's appropriate. We might need to modify treatment regimens. And then we sort of call on all of the ancillary services and resources that we know. So we make referrals for patients to physical therapy, to speech therapy, occupational therapy. As far as the cognitive changes, we try to make referrals to neuropsychiatrists and neuropsychologists so they can evaluate the cognitive changes that patients have undergone. They might provide counseling. As you know, this is sort of a life-threatening, life-altering event. And so there's a lot to deal with at that time. We also would focus on integration, or we do focus on integration of some of the complementary therapies, thinking about complementary medicine, nutrition, yoga, acupuncture. We want to really pull together that mind, body, spirit sort of focus on improving one's health. The key is that we need to remember that the patient needs care, but so does the caregiver. We need to make sure that the caregiver has resources to make sure that the patient's needs are met, that they have access to counseling. They too this is a life-altering event for them. Their life is different the day that diagnosis comes. As Vicki said, it becomes our brain tumor. We can make referrals to social work to help with the financial things, and also provide respite care if necessary, or make referrals for respite care. I think anybody who's experienced with neuro-oncology realizes that the changes that patients and families undergo are chronic. That patients and families continue to suffer ongoing losses, and that their needs continue and change, even sometimes in spite of stable disease. So they have, yes, physical changes, cognitive changes, and emotional changes, but there's also changes going on in people's social lives. Their social status may have changed, as well as their financial status. So that is really why I'm excited to be here today and part of this talk. And I'm excited about what's happening here at UCSF. Not only do we have like amazing things happening on the bench, we have the top neurosurgeons in the country, we have access to cutting-edge therapies, but the UCSF Brain Tumor Program, as Jenny talked about, is about to launch or formalize a program for patients and caregivers that's dedicated to supporting quality of life issues and helping assist patients deal with those. We're going to have a team that's committed and available to optimize care surrounding quality of life issues. And so they'll be doing what I talk about that I do now, but they're going to have the time and the resources to really make a big impact. So they're going to do even better. They'll be focusing on education, assisting with navigation, providing care, ancillary referrals to ancillary services, and again with a big focus on caregivers, because we know if we can help take care of the caregiver, then they can take care of the patient, which then improves the patient's quality of life, which then circularly improves the caregiver's quality of life. So it can only be a good thing. It's a big circle. So I'm really excited about this, and I think it's really going to set UCSF above the rest. It's going to give us a little set us apart, and more importantly, though, I think it's going to have nothing but a positive impact on the difficult journey that our patients and families face each day. Thank you.
Thank you. Thank you,